Hi, I'm Emily Wegman with Carolina Pelvic Health Center, and today I'm going to be talking about how to use dilators for gently stretching the pelvic floor muscles and helping to reduce that fear and anxiety that may be produced by your brain, which causes pelvic floor muscle tension and pain. Many of you may have been diagnosed with something called vaginismus or dyspareunia, or maybe you just can't have a GYN exam. And so these dilators might be helpful for you to achieve your goals. There are lots of different systems out there. The traditional one are these Syracuse dilators, which are plastic in nature and a little rounded. And they are nice because you can make them cold or you can warm them up a little bit, and they're easy to clean. And they start with a small size and then work up to a larger size that's more similar to your partner's size. Then there's a silicone-based dilator set that starts with very tiny, like pinky size, and again works up to as large as you need. And then the more classic set, the vaginismus.com set, which is more like a nesting kit where you have a small size and then you keep adding on to it. There are other ones out there that we also have on our website that you can check out at carolinapelvichealth.com. And then we also use vibrators, which can be handy for softening the muscles externally, that perineal body space that gets very tight in and around the perineum, and desensitizes the area prior to using dilators. When you go to use your dilator, you want to be in a comfortable position where your legs are supported, and you want to use plenty of lubrication. So make it messy. And then you start with your smallest dilator, and then very carefully you take a breath in and gently insert it into the vagina, and then hold it there for a few minutes. You can practice taking it in and out, doing your nice diaphragmatic breathing, or moving your legs in and out. Once that becomes easy, you progress to the next size and then repeat. We also like to encourage movement because oftentimes the pelvic floor will freeze or tighten and people complain of a fullness sensation or like they're hitting a wall. And beginning to use the dilators and moving your legs and breathing at the same time can be a nice way to progress. If you're working with your partner, talk to your therapist and determine if having your partner insert the dilator can be helpful as well. That's a nice way to integrate intimacy and begin to have comfort and enhance communication. Visit your physical therapist to learn more how dilators can help you, and give us a call at 919-571-9912. Take care.